Hi everyone, welcome to this Facebook Live. I'm Kara Sundlin. Orthopedic Surgical Partners is dedicated to delivering superior orthopedic care in Connecticut. So here with me now is Dr. Andrew Litchfield. We're going to talk about all things that go pop, sprain, bunions, everything, get all the questions out of the way. Thank you for being with us.
Yeah, thanks for having me.
Yeah, so this is the time, especially, I know fall sports have been starting up, so certainly with kids or maybe adults who've been spending their time golfing all summer and things are bothering them. But talk about the initial evaluation. Like, how do we even know if we should go to the orthopedic?
Yeah, so when you start to have pain, aches in your foot or ankle area, then, really an evaluation by an orthopedic surgeon or myself in our group is important because we can get initial x-ray, do the initial evaluation, and just have an honest and open discussion about, well, what is going on? And we can make a shared decision as to, well, what treatments are available. We start conservatively. And then if it unfortunately does need to go to surgery, then we can have that discussion as well.
Okay, so there are some conservative options, the good old-fashioned ice and all this. But then if it's more serious injuries, a lot of people talking about what happened to Aaron Rodgers. The UConn quarterback is been sidelined. So serious injuries like that, tell us what people need to know.
Yeah, so with Aaron Rodgers specifically, that's definitely been a topic of discussion. And Achilles tendon ruptures are one of those things where, yeah, I mean, it is something that does tend to need surgery, especially in athletes. And it's something where, well, some of the newer techniques and innovations we have today do allow for a quicker return to activity and also a faster return to sport as well. So we can cut the return actually almost in half compared to traditional techniques.
Okay, so it's really important to go and find out what your options are. Talk about some of the newer advanced techniques you all are using.
Yeah, so a lot of the techniques, and the foot and ankle is interesting because there's been a lot of new innovations and techniques recently. They're all really geared towards getting you back to activity and function faster and with less pain. One of the ways that we do it is with more minimally invasive surgery. So we can do a lot of things now where it's almost a scarless surgery, essentially.
Okay, so it's really the technology that's changing it?
It's the technology, but it's also some of the surgical techniques. They've just been more refined.
Okay.
So we have a more reproducible outcome.
Yeah. Now, what about there's traumatic injuries, there's sports injuries. If you're one of those people that you're out and something goes pop or something hurts, what's step one?
Yeah, well, step one is definitely getting off of it, resting it, icing it, supporting it, and then definitely getting it evaluated, especially with popping noises that we hear commonly in athletes. It can be a ligament injury, it can be a tendon injury, or it can be a broken bone, and that's something that you want to get evaluated immediately so we know what's going on. And educating is really important. So knowing what's going on and then taking it from there. So
many moms out there, and I know I'm talking about with kids, my son was coming home complaining he started football shin splints or other people. And there's sort of, I think we've all been really careful with concussions. The coaches are in on that. But the other stuff of like, how long do you wait to determine if you need to go to see someone like you? Yeah, and that's one of the things that we commonly see are the ankle sprains. The common ankle sprain is really a neglected injury because I think everyone thinks, oh, I can walk it off, I'll feel better in a few days. Where if you come to see us almost initially within the first few days of injury, then we can at least set you on a course to get you back to 100% as fast as possible. And if you don't, and you just let it heal on your own, because kids, I guess, do heal pretty fast, sometimes things might not heal exactly right. Yeah, exactly. And you can get things like long-term consequences like instability or also pain and sometimes arthritis too. So it is important to get it evaluated thoroughly and then taken care of, so that way you don't have any long-term issues. And you're with OSP, Orthopedic Surgical Partners, so right here in Connecticut. And people will wonder, and they'll say, well, I don't have an orthopedic, but places like you can get in, right? That's the whole point. You're basically in the business of urgent care. Yeah, our office is great. So we always say that injuries don't wait for an appointment. So you can walk right into any of our offices and you'll be seen. Walk in? You can walk in, yep. Even like, okay, I just pulled out my back and I don't know what to do, just drive, we'll have someone else drive you over to OSP, any of the, and where are your offices again? So we're in Rocky Hill, we're in Manchester, we're in Avon and Willimantic. And yeah, like I said, you can walk in anytime in business hours and you'll get evaluated and the proper treatment can be initiated. Okay, so let's talk about bunions. I know a lot of people suffer from bunions and they think that they're just going to have them forever. Not so? Yeah, so bunions are genetic, unfortunately, so you are born with them. There are things that aggravate it, so definitely the shoes you wear, your activities, that can cause it to hurt worse or progress faster. And what a bunion actually is, it's almost a structural deformity, so it's not just a growth or anything like that, but it's not something you have to live with. So there are conservative options we try first,
If those aren't working, then there are surgical techniques to correct a bunion. And that is one of the areas where there's been a lot of exciting innovation. Again, more minimally invasive type surgeries that do leave you with an almost scarless surgery. They definitely reduce your pain and your increased activity as well afterwards. So it's kind of an exciting area.
So if you have a bunion that's really hurting you, it's a good thing to get it evaluated because you could probably do something about it. And if you don't, the risk is it might get a lot worse.
Yeah, so I think, getting evaluated is really important because then we can address the severity. And then once we know the severity and what's going on, then we can have that discussion. And it is something where if you do get it fixed early on, the surgery is a little bit easier, the recovery is easier than if you were to wait. Because if you wait, they do worsen. And they can get to a severe point where the recovery is a little bit harder if you wait too long. So getting it evaluated and addressed early is actually beneficial.
Yeah, and because it's a real thing, and people talk about them not liking them, but it's also you'll have, if you get it taken care of, you're talking about more range of motion, increased mobility, all of that.
Yeah, and just an overall easier recovery.
Okay. So if you do have an injury, this is basic for the moms out there or for themselves. I mean, is there a rule about like right away, heat or ice, or does it depend?
Yeah, that's such a common question, and it's really ice, right?
It's ice, okay.
In that initial week where you have a lot of swelling, inflammation, the ice will definitely help reduce the swelling, help calm down the inflammation, and that's kind of what your body wants initially.
Okay.
Now, heat is definitely good for those chronic injuries, so if it's been going on for a month, it's more of a nagging thing, then heat can also help, but yeah, initially, ice first week.
Like
really
free
helpful.
information you were just telling me from my son before we went on, that go ahead if you're having overuse, shin splints are just basically overuse, getting you back to fall sports. So maybe some orthotics, maybe all these kids wear their shoes too big, maybe his feet are moving, but otherwise ice. And the same thing with like a sore ankle. If it's a really bad sprain, we should probably go see you. But otherwise, the old-fashioned, put your foot in that bucket with the ice.
Yeah, I love the ice bath. I think is great. So icing it, anti-inflammatories, a little rest. Those are things that really help early on.
And I've always heard, my grandmother told me, and I hear Tom Brady likes them too, Epsom salt baths.
Epsom salt baths are definitely a very popular thing, and I think they're great. They do help with symptoms, so anything that helps you feel better, I support fully. So Epsom salt baths are actually very good.
They are good, okay. And any foods or supplements that we should be taking to protect ourselves? People talk about magnesium, fish oil.
Yeah, well, it is important to keep the electrolytes, especially in athletes. You want to maintain your electrolytes so you don't get too dehydrated, so plenty of water.
Okay.
I think when we talk about anti-inflammatories, and maybe a lot of people don't want to take medications, a lot of people take turmeric now, and there's nothing wrong with taking turmeric. It has been shown to have some anti-inflammatory properties.
Okay.
So those are just things you can do to.
So turmeric would be more like a preventative, a daily type thing, and that's yes, it's used. I know in cancer trials, lots of things. You could cook with it, but otherwise, at the initial set of an injury, taking that anti-inflammatory like an Advil or something, if you can really help.
And that's the common question too, is well, Tylenol versus Advil or Aleve. And it's the Advil or the Aleve or the Tylenol or the anti-inflammatories that are a little bit better than Tylenol.
Yeah, I'm one of those people where I feel like Tylenol doesn't do anything for me, but Advil is going to.
It's so true because Tylenol is not an anti-inflammatory. So with that initial inflammatory period, you do want the anti-inflammatories to help you out.
Okay, so once again, and please like and share this if you have anyone in your family, or just if you're a mom, you might want to bookmark this Facebook Live or jot down orthopedic. We've got OSP, and so you've got the orthopedic surgical partners. Again, walk in. You said injuries don't wait, so we can come find you. We can ask for Dr. Litchfield, or we can go to any of your partners and tell everyone the locations again. Yeah,
so we're in Rocky Hill, Manchester, Avon, and Willimantic, and yes, please walk in. During business hours. Again, we'll take all injuries. You don't need an appointment. Yeah, Dr. Andrew Litchfield. In fact, the ones in Rocky Hill, you're right near here. So I know plenty of people here when they've had a problem, they have gone over there. And so that's one of those things you can get. And just lastly, before we close, a lot of people are afraid to go to an orthopedic thinking, I don't want surgery. I don't want surgery. And you mentioned a couple times that you start conservatively. Talk a little bit more about what the treatment might be that wouldn't even involve surgery. Yeah, and I think that's a very important point because that is a common concern that we hear as well. And my approach, and everyone in my group too, is we always approach it with evaluating the patient as an individual and listening to their concerns and then educating them on what will work best in their situation. And it always starts conservatively. And that would be the rest, ice, anti-inflammatories, and physical therapy is a pretty mainstay early on for a lot of conservative treatment, as well as some braces, some orthotics, some different types of support to kind of support the injured area while your body tries to heal it. So would you get the
orthotics from someone like you, or do you go to the podiatrist?
Yeah, we do them in our office.
You do them in your office, okay.
Exactly.
So a lot of people, I think, probably need orthotics, and then they don't get them, but that can make a big difference.
It does. It make a huge difference, and it does prevent injury, too. So it helps not only prevent some overuse and stress injuries, but it kind of helps realign the foot and ankle and support everything above it as well.
Especially for those of us who have flat feet. Apparently, we're supposed to wear them.
It is helpful.
It is helpful, yes. It's probably also helpful not to wear so many heels. But all right, so Dr. Andrew Litchfield, thank you so much. Orthopedic Surgical Partners, again, you can check them out. They're right here in our community. They do everything from sports and traumatic injuries, foot, ankles, arthritis, bunions, hammer toes, flat feet, all of it, ospct.com. And you can also call 860-525-4469. You can mention that you saw Dr. Litchfield right here on WFSB's Facebook Live, or just go walk in. He told you walk-ins are welcome, right?
That's right.
All right. Thank you, doctor, for your time. We appreciate it.